And as reports of COVID-19 case counts continue to rise, so does the demand for COVID-19 tests. However, some people may wonder which test is best. Fox 43's Victoria Lucas spoke to one local infectious disease expert who says it depends.
We're almost 2 years into the COVID-19 pandemic. If you think you may be infected, it's best to get a COVID-19 test as soon as you can. But finding a test right now may be difficult.
There is a lot of disease, a lot of gathering, and a lot of people trying to keep themselves safe.
Dr. John Goldman, infectious disease expert at UPMC, says with more people being exposed to the virus, lines for COVID-19 tests will continue to grow. There are currently 2 tests available, the PCR and antigen. But how do you know which one to choose?
When we admit people to the hospital and we're worried about COVID, we check everyone with a PCR. If you need to get a test before Christmas dinner, the issue is that you can get a PCR that's negative 3 days before and then get COVID Christmas Day.
Dr. Goldman says he recommends the antigen test for immediate gatherings because you can get test results in the same day. He says these tests may also be a better option for children.
Home tests are actually a little bit better with kids. It has to do with the fact that kids probably have a little bit higher viral load, and it's probably easier to get a good sample since they have smaller nasal passages.
And with a greater demand and in some places a shortage of COVID-19 tests, Dr. Goldman says he understands not everyone can get one, but stresses getting vaccinated and boosted is the best way to prevent the spread. Victoria Lucas, Fox 43 News.
And Dr. Goldman says out of the 2 tests, the antigen is easier to obtain amidst this current shortage.